Hey guys.
Welcome.
Oh, hey.
Okay, who's going first? Me? I'm already talking. So, welcome back to the 50 Shades of Pain show, where we're going to be talking about new updates in
migraine meds.
Ooh.
Ta-da.
Oh, I think it's done now.
Yeah.
Hey, welcome back, everybody. So thank you very much for joining us once again on the 50 Shades of Pain show. And hey, you've got a treat for you today because we're going to be talking about
migraine meds.
So we're going to be talking about some specific things about migraine medication. So, Danish, what do you think is something that's important about migraines and that's been a problem for your patients?
Well, there's a lot of things that are problems with migraines. Are you thinking of something specific?
Yes, and I'm hinting at migraine meds because that's actually what we're talking about today.
Well, for a long time, we've only had a couple of different classes of medications that can help with migraines. And more recently, there's been this ballooning of different medications that all fall in this one category that works on one of the, we've talked about how there's a chemical soup that the brain sits in, and in that chemical soup there's a lot of different ingredients, one of which can be an inflammatory chemical, where we don't really know why it kind of grows or evolves, but we know that it does cause headaches. And this new category of medications targets that specific inflammatory molecule.
That's right. They're called CGRP, calcitonin gene-related peptides, and we know that people who suffer with migraines have a lot more of these than people who don't. And so what happens is these little molecules float around your brain, and when you get a migraine, they bind to a receptor. And when that happens, that causes inflammation in your nerves, which triggers those migraine headaches. So for a long time, all we had was triptans for treating headaches, and maybe a couple other even older medicines, but they're all fraught with a lot of side effects. These newer medications, besides having fewer side effects, can also prevent migraines. And they're the first drugs really to come out that prevent migraines that were made for that purpose. And we've used some other classes of meds that just happen to also help prevent migraines, but they also have a lot of side effects because they were made for other problems. So these CGRP meds are pretty awesome.
Wait, these things don't have side effects and can prevent migraines.
That's right. That's right. For up to now, you've had your 9 pills a month that you can take of your triptan, like Imitrex. And if you run out, you're out, and that's the end of the story. And now what we can do is give you a shot, or you can give yourself a shot at home, a very tiny little auto-injector needle. And what that does is set you up to have fewer migraines, less severe migraines, and much easier to treat headaches if you do get breakthrough headaches.
Now, Dawn, we didn't introduce ourselves. I'm Dr. Danish. This is Dawn, our physician assistant, and it's James Dr. Escaloni, who's our physical therapist. But Dawn, you're not just our physician assistant, right? You are actually a migraine sufferer. This is like one of those hair club for men moments.
Yes. And I will tell you, this has been life-changing for me. I've gone from having some kind of headache almost every day and very debilitating migraines 3 times a month to having sometimes a week or two with no headaches at all. And when I do get a breakthrough migraine, they're very easy to treat. Sometimes even Tylenol will work, which never, ever was the case before. So I don't run out of my triptans anymore.
Wow, this is some impressive stuff. And so you guys at home, patient and expert. Pretty cool stuff.
Yeah, if you're already a patient of ours and you see us for something else like your back pain, don't forget to let me know you also have migraines, and we can help you with that.
Yeah, and there's not just one size fits all solution. A lot of people take a combination of medications, different types of injections, some exercises, manipulation, acupuncture, but the primary thing to remember is that you don't have to suffer alone. That we actually, personally, we get it, and we want to make a big difference in people's lives. This has just become one major tool that's been a huge resource for a lot of patients who really struggle with this.
Mm-hmm. Yeah, that's why we have our HEAL methodology here. What is that again?
Yeah. So HEAL methodology, Dawn, what's the H stand for?
Of course, we're going to hear what your body's trying to tell us.
Right. Listen to what the body's trying to convey with pain. Mm-hmm. And then we want to, James?
Envision the life you could have without that debilitating pain.
Right. Because a lot of times we struggle with just who we are and what we want to do, our sense of purpose, when you're dealing with a chronic pain that you think all the time, can I do these things without hurting?
Sure. Dr. Donish, do you remember what A is?
Alleviate the symptoms. So it's our short-term plan. How do we get your pain under control so that we can start to build the long-term plan, which takes us to L, which is
leverage. All these tools.
Leveraging the way the body heals, figuring out how we can better utilize the mechanisms within the body that restore it back to normal health in ways that really aren't well thought of in conventional approaches in medicine. So these medications are really helpful. Injections and understanding the root cause of headaches is really helpful. And finally, getting the mechanical stabilization that can help reduce the inflammatory or the chemicals that cause that soup to become too salty or too spicy.
Too juicy. All right, cool. I think that we came up with some really good solutions and some really good questions. So for you patients at home, if you're here with WellWord, you got to talk to the expert here. She will help you out. And if you guys have no idea how to get a hold of us, look up wellwordmed.com. All right, we're on the internet. We can help you out. Become a patient. Call. We will help you out. That's our promise. Bye.
Thanks, everyone.